Good afternoon. So today I'm going to report the results of our targeted NGS analysis. And in our diagnostic lab, 155 individuals have been analyzed using a customized panel, including 31 genes on the Ion Torrent PGM platform. And this is the flow of our molecular analysis that goes from the wet lab part to the data elaboration in silico analysis and molecular interpretation, and we apply some filtering criteria such as depth of coverage more than 20x and minor allele frequency, and we take in consideration in silicon prediction and conservation analysis. And for all the patients that has a variant, we do also a family segregation analysis. We have been identified 21 pathogenic or likely pathogenic variants in ion channels, SCN1A, 2A, 8A, also KCN2 and HCN1. And we have detected different kind of variants such as novel, de novo, non-disease-causing variants, familial transmitted variants. And the variants in the sodium channel are widespread along the protein sequence. This is the table, I'm sorry for the dimensions, where you can see here there are the genotype of the patients, and for all variants we perform in silico analysis such as SIFT polyphen that give us the probability for the pathogenicity. We take in consideration of the CAD score, the phylogenetic conservation. We do also do an interval. We use the interval tool, and we combine all the genotype information with detailed information about the phenotype, ranging from the seizure onset, type of epilepsy, fever sensitivity, intellectual disability, and development. And here are 4 cases that our clinician thinks that can expand the phenotypic spectrum of SCN1A and SCN2A. And the first patient is a patient that arrived at our lab with a diagnosis of a typical picture of early onset focal drug-resistant epilepsy. And he had de novo variant in SCN1A. But he also had a variant in KCN2 that was present in his mother and in his sister, and both of them all of them are asymptomatic. The second one is a male that has epilepsy with focal crisis. And he had ocular opsoclonus associated with spasm. And he had a novel SCN1A variant that was maternally hereditary, and the mother was asymptomatic. And we started to speculate that this could be a case of incomplete penetrance or mosaicism, maternal mosaicism. The third case is a female with West syndrome with focal crisis, and she had a de novo variant in SCN1A. And the last one is a female with a diagnosis of Isers disorder that has a de novo SCN2A variant. So the use of NGS has become a routine molecular diagnostic strategy in patients with early epilepsy, and our overall diagnostic yield is 70.4%. But in patients with seizure onset within 12 months of life, this is 22.7%, indicating a higher diagnostic specificity of the panel in this cohort. Our work further strengthened the importance of a careful phenotype characterization coupled with the power of NGS technology, and our findings indicate in a subset of few genes major player for epilepsy with early onset.